Welcome to Conversations Over Coffee. In this episode, I am chatting with Carisa Bamford, Senior Director of Physician and Nursing Experience and Development at Banner Health. There's a lot of love for Carisa here at Practicing Excellence, as she was a big early advocate to create the Nursing Experience Project, our newest product released this year. In celebration of this, let's hear about her reasoning for championing NEP and in the benefits that she has seen implementing it at Banner Health. Well, Carisa, you've been working with us here at Practicing Excellence to coach and develop your physicians and APPs for a while now. Seeing the benefit to your physicians, you quickly came to us and said, we really need to bring this to our nurses. Being the backbone of healthcare as we know it, we need resources for them. What drives your commitment to nurses, and what did you see happening that compelled you to find those resources?
Yeah, I think it's a really good question. We did see a lot of success with our physicians by being able to provide them with tools and resources that allowed them to be successful at all the expectations set in front of them, right? So when you think of the priorities of a health system, a lot of times, there's measures and there are metrics, and it's so easy to let those metrics sometimes trump the mission. And we don't do always a really good job at giving them tools to allow them to be successful at that. So that was something I know that really early on we said, man, nurses are going to need tools. And I would also say, right, it's no secret, right? When you think of the experience that all of our healthcare teams have been through the last, 2.5 years has been hard, like really hard. And even before the pandemic hit, you could look at a lot of different research and different articles. Upwards of 70% of nurses already experiencing symptoms of burnout. And then knowing that after the pandemic, what were we going to be facing? And again, when you look at major crises across kind of US history and world history, a lot of stuff talks about 2+ years of recovery time. So after you experience some major crisis, it takes a long time to heal, a long time to get back to, a quote unquote normal, if you will. And I think we wanted to be really intentional about how do we support nurses through kind of their recovery and healing. And as we know, there would be more expectations put in front of them, right, to be able to care for patients. We knew it had to probably look different, and that was going to be hard. So really, I think NEP for us was kind of this thing where we knew we needed to really stand something up to support them, make them feel valued and invested in, and allow them to really have the tools they needed to be successful.
Well, from that simple conversation sprung the Nursing Experience Project, what we've been talking about. And so Banner Health is one of the first major healthcare systems to implement NEP with their nurses. What has been your approach to roll out NEP to your 17,000 nurses, and what impact have you seen so far?
Yeah, so I'll tell you, I think anytime we're implementing something like this that's a tool, I always think the best approach is leaders go first, right? It's important that leaders are setting kind of the tone, the culture, and that they're able to role model these kind of behaviors before we even get it to the front line. So actually what we've done was last fall, we kicked it off to every nurse leader at Banner, and we have them going through a leadership program. And the coolest thing about that is when you think of the power that you get behind everybody watching the same content, the same video every week, right? So it changes every week for us. It's pushed to them. It's so easy because honestly, there's an app reminder on their phone. We get an email. So every Monday, our nurse leaders are getting in there and watching a video. And it's the same, again, content that everybody else is watching. And then even better than that is how then are they talking to each other and their teams about that content, right? And we're watching it live out. The coolest thing that I love doing almost every week is getting in and looking at the comments that people leave after they watch a video. And they are robust and they are deep. People are really enjoying the content from that perspective. I think they really feel like it's something that's for them. If you think of nurses, but particularly our nurse leaders, they haven't had time to give to themselves, again, for over 2 years. And this is a little bit of something that they can have that's just for them, which has been really exciting. We have plans this summer to roll out to the rest of our frontline nurses. So A big undertaking that we'll have, but it'll be great because our leaders have already kind of been there, done that, right? They can speak to it. They'll be some of our greatest advocates, and it'll have, I think, a lot of power as we start, again, everybody rowing in the same direction, as everybody's kind of watching the same content. I think for us, a lot of the things that we're thinking about right now are, what are the expectations that are set in front of our nurses that are at the bedside, particularly, and how do we help them feel like they have a tool right in their pocket that allows them to be successful at some of those things. And I think healthcare right now can be really dreary if you let it. And one of the things that what we're seeing from NEP is it's a shining light. It's kind of this beacon of hope, almost allowing people to have, something that's telling them it's going to be okay, and here's a way through it, and it's simple and it's easy, and they can put something into practice, almost immediately. Yeah.
That is all the questions I have. Carisa, thank you so much for joining me. It's been great having you on here, and I look forward to what you're doing at Banner Health to help these nurses.
Yeah, you bet. It's been a pleasure, Ryan. Thanks for having me on.